Stephen King once said, "You can, you should, and if you are brave enough to start, you will." For a cancer patient, optimistic spirit, courage is their most powerful weapon. Help them overcome the demon inside them, especially cancer. And that is also our intention when implementing this project. In our thought, if we are brave enough to start, we will win. And that is exactly what we are doing, a beginning to change. My name is Mỹ Tú, Minh Tú, and Thanh Trà. We are here today to demonstrate our palliative care program, which is aiming to help children from the age of 3 to 18 who have cancer have a better life conception, make their short lifespan the best experience they have. Our project has 7 main points to discuss. We will start our discussion by giving the definition of palliative care, what we will do to help children. Then we will explain the process, how can we do to help children. Next, we will discuss about the $2,000 budget plan and human resource, our volunteer and recruit plan. Although, however perfect our may sound, there are always a small probability that something will wrong. And for that, we have come up with some solutions for quiz may come up. Not only will we discuss about promoting our project through means of media, but also evaluating how much our project will succeed. To start off, there are still some of you don't know what palliative care is. Palliative care is an approach to specialized medical and nursing care for people with life-limiting illnesses. It focuses on providing relief from the system, pain, physical stress, and mental stress at any stage of illness. The goal is to improve quality of life for both person and their family. With this program, we are providing a way to help, including the patient and the family, providing them a new, healthy playground, love, care, empathy, rebuild their trust and belief. And last but not least, we will help make their lives better. What doesn't kill you makes you stronger. Inspired by the words of Friedrich Nietzsche, we come up with this plan in order to make our thoughts reality. Our project consists of 7 main points. They are human resource preparation, meeting the family, meeting the doctor, party, meeting the patient, and necessary information. Firstly, recruit plan. There is nothing more important than our volunteers. Nevertheless, they are the heart and soul of this project. That is why we must have the best people on our team. We target on 3 candidates that are volunteers by applying to help us out. College, university students, mature in medicals who are in need of experience dealing patients, improving themselves on their field, and finally, high school students. However, they are not qualified volunteers if they haven't yet taken 4 most important skills such as listening, communicating, knowledge about cancer, and of course, emotional health. They have to understand and empathize with the feeling that the patients have. It is easy to get the wrong idea about one's emotion. That rookie mistake can lead to regretful consequences. As to have the best solution for our patients, there are some predicted feelings they may have throughout the treatment. According to the book When Professionals Weep, the authors have given some examples to modify clearly what the patient may feel. Helplessness, shame, embarrassment, denial, and the wish for it to go away, anger, or even depression. With careful preparation and research, surely we will create an ideal team up for the job. Our demand for the ideal team is not just what they know what they are supposed to do. Furthermore, they have to work well with each other, help their teammates in order to achieve satisfying results.
The second step, that is meeting the family. Parents and siblings are the people that you can count on to give personal information about the patients. First off, the religion. The child's belief in the existence of God is one way to get closer to them. Explaining the definitions of death, making them believe that they will be in heaven, in their God's arms protected. That may somehow relieve the child's fear of dying. Secondly, we know their hopes and dreams. Thirdly, we get to know what are the family wishes for them and for their child. The patient's habit, routines, and personality are also important. Finally, the family financial status.
Our third step is that meeting with the doctor. Our team will get all of the health information about the patients, especially what they need like vitamin, exercise, as well as what they need to stay away like allergies, food that bring out the side effect of meds. The treatment follow closely. Our team will cooperate with the doctor in order to give the best their patient needs. The fourth step is get together party. We're hosting this party in order to meet the patient. Throughout the process, we will create a friendly environment, building trust between our teammates and the patient. We will have make their lives better. This e-chart will summarize the work we actually do around the patient, which is actually really simple at three main points: observation, conservation, connection. Accompanying children in the treatment process, supporting children during this time to understand more about cancer patients. Solving basic problems from that helps the relationship between children and parents become better and better. Adding positive energy to life, changing the perspective of patients about life, living the best when possible. If everything goes as planned, the patient gets better through the treatment, then our work is done. But for those are unfortunate, the health condition turn worse. Tumors have spread all over the organs. There is nothing that the doctor could not do. We will be the last resort. When everything fails, we will provide the patient family with a class hosted by a specialist, giving them all information about skill in taking care of the patient at home, the patient diet, help the family physically and mentally. Lastly, the reparation when things go out of hands. After having gone through the timeline, I want to address the $200 budget. With the $200 on hand, we will spend it on 4 mature points. 50% of it will be inviting the specialist. 30% of it will have host get-together party for the children. 10% of it will go to promotion PR of this project, calling out for sponsors. The last 10% we will save up for any risk we have to pay for. Our fourth mature point is human resource brand. As in the beginning of the presentation, I have said that there are 3 candidates we are looking for. We actually have specific work part for them. Beginning with the high school students, being the youngest candidate of all, teenagers are likely to have more similarities with patients, giving them the advantage to engage a conversation with them. Easier to feel, easier to understand and empathize. There are similarities in age and psychology, so children become the key to understand children. They will observe the patient carefully and write down carefully in our program patient record. These are extremely important manifestations of the patient mental level. Next off are the volunteers. They will ask and judge how much pain the child is suffering through many ways we have taught them. For the children who are in the age of 1 to 3, they observe the child behaviors. For younger children, volunteers will be instructed specifically observing the expression of children who do not speak or do not want to speak. This group will handle more complicated work, such as taking care of side effects after the patient drinks their meds or after radiotherapy. Cooperate with high school student groups, have the patient relieve their pain, stresses. Finally, the intern group. Them and the doctor will help provide painkiller prescription most suitable for the child health status. Help other group with their work, give them advices and ways to do the job, being the most familiarized with field. The intern group will personally checking the patient health, observe and report on the patient record. There will be a meeting among the volunteers. We will give them instructions, risk no one wants. Although there are still some cases that negative thoughts from the patient will hard to replace. Child thought about meaning of life and death. To them, death may mean the end, that nothing else can be done. There won't be heaven or hell. Then why they have to bother themselves with living their life, because eventually they will die before they can doing anything for them and for their family. That is why we want to make it clear to our volunteers that what we do it from the heart. We have to see ourselves as someone who will make a big change in someone's life. We have to make our patients realize that there are still people who wish they can live a happy life when they still can. There is also some risks involving in lack of human resource. They are the main power to keep our program going. That is the reason why we must attract as many volunteers as possible.
There is also some risks involving in lack of human resource. They are the main power to keep our program going. That is the reason why we must attract as many volunteers as possible. There are many ways to sign up, but how can we maximize the influence to everyone? How can we let them get to us as many as possible? And our answer is part 6, media. We want to be known by youngsters, adults, people that usually use technology. That is the reason why we choose some social networking sites which are popular in Vietnam. Besides from posting register on our own Facebook, Twitter pages, we also give this self-designed brochure in order to call out for help. On our brochure, we make it crystal clear about our wanting age candidates, what profit will they gain from the program, our meeting time and places, and last but not least, contact info. Besides from high schools, colleges, medical universities, we are also giving it out at some parks, public bulletin boards, etc. That way the risk of short human resource is not a big of a deal anymore. To end our presentations, we get through with part 7, success evaluations. As you can see, there are 4 keys to success. Our top criteria is our patient's new motivation. Just because your life is short, that doesn't mean you spend time grieving for your own pity. We will help our patients make the most of every second, inspire them with new activities suitable for them. They can also devote their work to help build our country. Then, our patient performance through the process. With other criteria, we can keep track of what we have done and what we can do to improve our program. Only then the most precious things we as creators want to protect. Our children smiled. After that is the critics from family. And lastly, the attendance of volunteers. Even though it may seem, we created this program in hope to help our children who was not fortunate enough to have a healthy and happy life that they deserve. We hope that with this program, we can maximize the effect of hospital in children palliative care. Such is a meaningful act. The world will be united and become a better place for nurturing our infants. And finally, we want our children to know that pessimism leads to weakness, optimism is to power.